As if heroin isn't already wreaking havoc on the Suncoast. Now, incredibly powerful and lethal synthetic forms of the drug are killing so many users, there's not enough room at the morgue to store the bodies. Kate Flexter joins us with more. Kate.
Thanks, Alan. Our community is in the midst of what's widely considered an epidemic. But now there's a fresh challenge for those battling this crisis in the form of synthetic fentanyl.
Oh, wow, look at that.
When Amber Gordon started using heroin, she knew the risks.
It's like playing Russian roulette, but you know, when we're addicted to that drug, we really don't care as long as we feel better.
Over the course of 5 years, she overdosed 3 times, and each time was revived.
Even though I experienced death, I really was to the point where I really didn't care.
The 3rd time, it was the drug Narcan that saved her. And that was when she finally decided it was time to quit and went to stay at Prodigal Daughters, where she had her son Grayson and is now 10 months sober.
Just having my son, I have a reason to live now.
Overdoses are now so common that Narcan is sold in local drugstores. But as the local heroin epidemic evolves and the drugs become more and more powerful, Narcan is less and less effective. This summer, law enforcement became aware of the introduction of synthetic forms of fentanyl, leading to a sharp spike in fatal overdoses. The medical examiner's office then developed a test to detect those synthetic forms of fentanyl.
We can now test the samples that we have and have been able to figure out that there is a lot of carfentanil causing deaths in Manatee County.
Since the first of the year, variations of synthetic fentanyl, or analogs as they're known, have been found in 8 fatal overdoses in Sarasota County and 38 fatal overdoses in Manatee County. Used as an elephant tranquilizer, the most lethal and most common is carfentanil, estimated to be 10,000 times more potent than morphine.
It just takes a tiny, tiny amount to cause very severe problems.
Now Chief Medical Examiner Dr. Russell Vega says first responders are finding Narcan has little effect on these synthetic forms of fentanyl.
The amount that they're used to seeing a response with in, say, more typical overdose patients with heroin or even fentanyl is just not being effective with the carfentanil patients.
Scott Kemp of Manatee County's EMS says that's exactly what they're seeing.
The response to the Narcan isn't quite as quick, and it takes a little bit more at times to reverse the effect.
In the year 2014, Manatee County EMS administered 700 doses of Narcan. In 2015, that nearly doubled. And in 2016, before year's end, it's almost doubled again, costing the county more than $100,000. Kemp says many of those addicts are overdosing multiple times.
Some of our field staff that could tell you of how they responded on one patient, treated them, taken them to the hospital, and then several hours later, even within the same 24-hour period, they're running on them again.
At Centerstone Addiction Center, Melissa Larkin-Skinner is at ground zero of this epidemic.
I've never seen anything like this, never. It's very disturbing and heartbreaking. It breaks my heart every single day, and we keep, you know, we're trying, not just Centerstone, but we have a whole community of people who are trying to find an answer.
For now, though, she says the major hurdle in this fight is a lack of understanding and awareness of addiction as a disease.
The big silver lining is people are realizing addiction is a disease. We're able to get the word out, and people are willing to listen right now because people are so desperate.
For Gordon, her concern is what will happen if Narcan doesn't work, and if people like her aren't given that 2nd and even 3rd chance.
I found it, and I am so grateful, and I wish that other people could have that opportunity like I had.
First responders tell us they have seen a slowdown in the number of overdoses in the last month.
Kate, thank you.